everyone, and welcome to Nurse Nay Educates. My name is Renee Jones, and I'm a NICU nurse. I've been a NICU nurse for a year and a half now, and I work at a level 3 NICU here in Mississippi. I'm at a birthing hospital, and in my level 3 NICU, we take care of the critically ill babies less than 32 weeks. A lot of them on ventilators and other medical equipment that we have in the NICU to help them grow and get better and send them on home to their parents, okay? So I started my page because I feel like there should be more education for parents to Google and just research out and online. So I started this page as a resource for parents and for nursing students or anyone who is interested in becoming a NICU nurse. So today we're going to get into my first topic. My first topic will be 8 tips for NICU moms, okay? So number 1, my first tip would be, moms, please be an advocate for your baby. When I say that, I mean when you're there at the bedside and you're there day and night, and if you see your baby has a change in activity or you're concerned about one thing or another, let your voice be heard and let your concerns be heard. You know, talk to your nurse, talk to your doctor, express your concerns and your questions to your nurse that's taking care of your baby, or the neonatologist who comes in the room and talk to you about any changes or goals that we may have for the day. So be your baby's advocate, okay? I can't express that enough. Be your baby's advocate. So number 2, I would say ask questions. Ask questions day in and day out. I don't care if it's the same question. I don't care if I just explained it to you and you don't understand. Ask me again. I promise you, most nurses won't get offended by it. Just ask. If you don't understand something, ask about it, okay? I've always said there's no such thing as a stupid question, and the only thing that will stop you is you not asking the question, and then you're confused about why we're doing something or why we do things the way we do. Just ask us a question, okay? So one thing I do when I'm doing my assessment, my head-to-toe assessment on my babies, and the mom or dad is at the bedside, right, looking in to see what I'm doing, I'm explaining everything as I go. I'm feeling your baby's head to make sure that the fontanelles, the little soft spot, is soft and it's not like sinking in his head or bulging out. And I'm moving on down. I'm listening to your baby's lungs to make sure it sounds clear. I'm listening to her heart, listening to her belly. I'm pressing on her fingers to make sure that her cap refill, like the blood circulates back to her fingers properly within the right amount of time, and it's not taking a long time. So while I'm doing my head-to-toe assessment, nurses out there, make sure you do that. Parents love to hear you explain to them why you're doing things with their kid. Okay, moving on to tip number 3. My tip number 3 would be, I know it is hard for most moms to form that bond because their baby's in a NICU and they may be still recovering on the labor and delivery unit or another unit downstairs or wherever they may be. So one thing I tell moms to help promote attachment with their baby, like talk to them, like they can still hear you. They love to hear you talking to them. They know your voice. So talk to your baby. I tell them sometimes you can bring a book and read to your baby. I know I tell my parents sometimes, like if they're too small, if like they're 20-something weeks, and they're not too sick to where they get really overstimulated by stuff, I tell them they can touch the baby, just containment touch. So containment touch is pretty much you holding their head and their feet and you just holding them like this. Because sometimes with babies that small, you rubbing on them and doing other things, it may overstimulate them and it could have an opposite effect, like they may drop their heart rate or the oxygen content in their blood may go down. So that's why we tell them not to like rub the babies if they're really small. like just do some containment touch, and that helps moms too. I know it may not seem like a whole lot that you can probably do at the beginning stages, but those little things like talking to them, reading to them, containment touch, even getting involved in the care. Ask your nurse, or the nurse should offer you to take their temperature, or sometimes I ask the parents if they do want to do the oral care. Sometimes we'll get your breast milk or just sterile water and do some oral care with the babies that are getting NG fed or not fed at all, so they can have some moisture in their mouth. So even if the nurse doesn't offer, you can ask, can I do some oral care or take their temperature under their arm or anything like that to get involved in their care to help with your attachment, your bonding with your baby. So number 4 would be, my 4th tip would be make some space in the room to make it personal. So here at my NICU, we have a space in the room for the parents where they can stay the night. And some parents, they bring like the little door hangers with the baby's name and the weight and stuff like that. And we let them post, like put pictures on their little incubators, the little box that the babies are in. You can put pictures of you and dad or other siblings like on, you can like stick it to with some tape. And also like little stuffed bears and books that you want to leave in the NICU to read to your baby. We have a spot in our NICU that you can place those things and nobody will mess with it, and you keep it there. That's to personalize your space with you and your baby. And I would suggest that to any mom, especially if you're trying to make it make the best of your situation. Make it as cozy and personable as you can, okay? And I would say that's a really good idea for most moms, bringing that door hanger. A lot of moms really love that. So for my 5th tip for NICU moms, I would say make sure you try to write in a journal. So I know a lot of moms that come through the NICU, they may have a little issue with bonding, and they may even go into postpartum depression. So one tip that I know that may help some moms and even dads is to keep a journal. So write down your feelings, how you feeling this day, even goals that the baby met. Oh, my baby got the NG tube pulled today, and now we're starting bottle feedings. The baby got off the ventilator, now he's breathing on his own. Like those marks, those milestones, they're big accomplishments, and they take a lot of hard work for the babies, and you should celebrate them too. You're a part of that process, and we want you to feel a part of that process. So write in your journal how you feel. You can even write your baby's progress in that journal, just making it personal to you, okay? All right, so for my tip number 6, make sure, mom, you get enough rest. So in order for your baby to get better, and especially if you're doing like skin to skin, we love moms to get some rest, okay? It does not help you to be, I know it's a stressful time and it's gonna be kind of overwhelming at the beginning, but we really encourage you to get some rest. Even if you don't want to leave the NICU, that's in my NICU, I can say it's fine. We can lay out our cot and get it comfortable, get you some blankets and pillows, and you can get some rest right here with your baby. You don't have to leave, okay? But we do encourage you to get some rest. How can you take care of your baby if you're not taking care of yourself, okay? So make sure you get enough rest. And number 7, along with getting rest, we want you to stay hydrated. Yes, hydration, some H2O. So if you plan on breastfeeding, we definitely encourage you to stay hydrated and rested up, because if you're stressed out and you're not hydrated, you can't really expect your body to produce as much as you want to produce or how you should be producing at that time. So stay well rested and drink some water, okay? I know most NICUs, most places in the hospital, they won't allow you to bring food back into the room, but you can, moms, I know at my hospital, you can bring water into the room, and moms can have water at the bedside. And for my final tip, number 8, I will tell any mom, rely on your faith when you're in these difficult times with you and your baby in the NICU, okay? Whatever your faith may be, that is the perfect time for you to focus and to pray and to meditate whatever it is that you do, so you can keep that peace and that inner sense of calm in you, so you can be all that you can be for your baby, okay? Especially when you get to the point where you're doing skin to skin, your baby feeds off of your energy. So when you're calm and at peace and you have that sense of faith in you, and it's so strong, and you know everything is going to be okay, you're being an advocate for that baby, it's going to be good, okay? So to recap, my tips, 8 tips for NICU moms. Number 1, be an advocate for your baby. Number 2, ask questions. No question is a stupid question. Ask many questions. Number 3, to promote attachment, read to your baby, talk to your baby, do some containment touch, okay? So number 4, I would say make space in the room personalized. Bring some pictures, some stuffed bears, the little door hangers. Make it personalized for you and your family, okay? Number 5, make that journal. It's your space, that's your time to keep up with your baby stuff and to express how you feel. Number 6, get some rest. Number 7, stay hydrated, especially if you're breastfeeding. Number 8, and the final tip is to rely on your faith, okay? So I hope this first video has helped at least a few of you moms out there that are looking for some resources, being a mom, first time mom, or this is your 5th kid and he or she is in the NICU. I really hope that it helps you and it gives you the faith to keep moving forward and keep fighting for your baby, because we have some good mamas out here and you guys are tough and you can do it, okay? Be strong for your baby and keep that faith strong. So if you like this video, please click the like button below and make sure you share it. And if you have any questions and comments or any ideas for the next video, just put them in the comments below. All right, y'all have a great day.